You probably wouldn't put up with the pain of a headache for weeks on end without going to the doctor. You shouldn't with your feet either. We log a lot of miles in our Tootsies, so we need to take better care of them. We're at the Foot and Ankle Wellness Center today to find out why pampering our feet is so important to our overall health.
We spend about 7,000 to 10,000 steps every day, minimum, walking around, and we don't think about it up until the time we start having pain.
So, doctor, you say that foot pain is not normal. How long do we put up with it?
Well, you shouldn't put up with it. It's not normal. You should come in, give us a call, see a podiatrist immediately to be able to avoid certain things. 80% of the time you come in, we can be able to help you on an immediate basis.
So if someone has foot pain, they make an appointment to come and see you. What's that first appointment like? What do you do, a consultation?
Yeah, well, we do a comprehensive evaluation of your problem. We take a focused history of what's going on, but we listen to you first. Tell me what your problem is, tell me where it's hurting, and then we'll focalize right down into the area where what's hurting. I'll watch you walk. We'll do some potentially x-rays to be able to evaluate any bony abnormalities, and then go back to the actual condition, and then I'll talk to you about your treatment options. I'll essentially diagnose it and then talk to you about your options.
So no 2 feet are made the same, pretty much. Is that true?
Not even on the same person.
Not really.
Some people's feet are longer than, one foot is longer than the other foot, and it's very common.
Okay, flat feet?
70% of the time, patients, our population has a lower arched foot, and then you've got a very small population that has a higher arched foot.
Is there anything that you can do then to help relieve the pain?
Yes, there's a lot of conservative treatment that we can do. One of them would be the use of orthotics. There's several types for different activities. This one is what I would consider like a mold, and that's for an older diabetic patient with very thin skin and something that, and poor circulation, so they just need a bit more of an accommodation as opposed to actual functional foot control, okay? And then this one here is more of a dress orthotic that'll help for a professional who's wanting to wear them in dress shoes, laced Oxfords, that kind of shoe. Okay. And then for the athletic patient, something like a full-length device would be even more beneficial because you've got the shock absorption with the top cover, the Spenco top cover, and then you've got a very thin shell, and that thin shell is very strong and it's flexible, so when you're running, it tends to absorb every step that you're taking when you're doing that high impact.
So when you have pain, you should be coming in right away.
You have to come in right away because it's the best way to be able to quickly resolve your problem. Like I say, 80% of the time we can help you on that first visit. And the other 20% may require further treatment, but at least be evaluated.
What can we do to not have to put up with that pain?
Well, there's a lot of simple stuff you can do for yourself with prevention. I mean, one of them is to be able to wear the appropriate shoes for the appropriate occasion that are comfortable, that are stable, that are being able to support your feet and your legs for the rest of the day.
Okay, so if you want to take those shoes off halfway through the day, there's a problem with the shoes.
Right, right,
Okay.
and then we have a problem.
All right. I hope you don't mind, doctor, but I went through my closet, brought in some of my favorite shoes, thought maybe you could take a look at them. I love them all.
They're nice to look at, except when you actually want to wear them, then you're going to be dealing with some problems here.
What's wrong with them?
Well, the thing is, you've got a lot of instability in the back here, the rear, the heel, and then you've got no ankle support here.
Okay.
Same thing with this one, no ankle support, and definitely too narrow.
But this wedge works perfectly, right?
But then you still got the pressure all the way towards the forefoot, so it's throwing your hips forward, and you're putting a lot of pressure there on the ball of your feet.
And tell me you love my boots.
That is the absolute worst one you could wear because that is the one where you've got all 5 toes squished into this little area, which is not very comfortable. Go easy on them.
Okay.
Okay, I mean, it's like anything else. Everything in moderation. You want to be able to wear them maybe for a couple of hours, or but you've got to have other shoes to be able to compensate for that, right?
Okay.
You don't want to just stick with these all day long because they will take its toll on your feet.
So not always about style. It has to be about comfort too.